Hi everyone, I'm Dr. Tani Ping, consultant obstetrician and gynecologist. Okay, so today we're going to cover more of endometriosis. Let's look at some of the questions that were posted up. Okay, something I always tell a lot of women is that fibroid's good friend is endometriosis. Most women have fibroid first, then followed by endometriosis. Why? Because fibroids actually distort the whole passage of where the period blood is going to go. So you see, our uterus is supposed to sit nicely in the center. It has two tubes at the side and there's a passage down, right? So when you have fibroid, you do not have this nice passage anymore. The whole shape of the entire uterus, the orientation of the entire uterus, and sometimes depending on where the fibroid is, it can even block the outlet of the menstrual blood and cause more period to be backflow. We know that endometriosis starts with backflow of the period blood. It starts that way, and then slowly this period blood that is backflowed fail to clear off, and then it will implant somewhere, and then slowly it will grow. When I do a lot of fibroid surgeries, especially women who cannot get pregnant, very often we do see endometriosis. In certain cases, we could actually remove the endometriosis together with the fibroid surgery, but sometimes it can be difficult because you can have a fibroid that's so big that is blocking my view to see the endometriosis. You need very good view looking at the endometriosis before you dare to cut it. Fibroids is different. Fibroid, you don't need to see well. You can just cut it because there's nothing dangerous that could happen. To endometriosis, it is quite dangerous if you can't see it well. You will have a situation sometimes where, because fibroid surgery tend to bleed, they don't bleed a lot, but they bleed those little, like the rain, like drizzling like that, one drop. They like to bleed like that. So sometimes this one drop of bleeding, again, I cannot see my endometriosis clearly because this blood keep dropping down because endometriosis is always behind the uterus and is down there behind the uterus, and the fibroid is always up there, and then the blood is dropping down onto the endometriosis. I also cannot see the endometriosis well, and as a result, this little endometriosis that you have previously continue to grow over the years, and now you have period pain. If you tell me you have period pain in your 40s and you never had period pain before, that is definitely endometriosis already. You may ask why you may not have the period pain before and you only have it now. You didn't have it after your surgery, but you have it now. There's only a few possibilities. One possibility is the amount of endometriosis at that time is so little. It's so little and it has not caused pain because it didn't grow in places that cause pain. So that's why you do not have any pain during your period after your surgery. That is one of the reasons. But this endometriosis continue to grow and now you may actually have pain. So that is one possibility. The other possibility, like I always explain to a lot of endometriosis women, is that we have three passages for the period blood to go out. The passage that goes through the tube that goes into the body that causes your endometriosis, that passage is usually very fine. You are born with very fine passage. But once your period starts to backflow, it actually flows through easily already. Over the years, it tries to backflow, and then eventually it will flow through. And once it flows through, it becomes very easy to flow through already. And when it backflows, it will forever backflow easily because the passage is now open up and it's easier to flow back. So that is why sometimes maybe you may not have endometriosis at the time of your surgery, but because it can backflow easily now, and as a result of it, it starts to backflow. And that is why now you start to have period pain. That could be also one of the reasons why you are not getting pregnant, because on top of the fibroid, you also have endometriosis. Okay, please share my video to everyone. So let's spread this knowledge. I'll see you again. Thank you and bye-bye.